End of the month. Here to talk more about it is former FDA Associate Commissioner and Professor Peter Pitts. Welcome back to Wake Up America.
My pleasure. Thank you.
Okay, so the FDA panel, they recommended that Pfizer and Moderna vaccine for children under 5. What do you make of this?
Well, the data is certainly there, and it's important for a lot of reasons, not the least of which is young kids are little virus incubators. So it's not just about protecting the kids, it's about protecting those who are around the kids, teachers, camp counselors, other adults that are in the vicinity. So it's a good thing. It's up to the parents, and parents have questions. They should talk to their pediatricians.
I think a lot of parents, they've been on the fence about even vaccinating their kids who are older, teenagers. I talked to a lot of parents on the soccer field, and I'm like, well, I'm not sure I feel, safe about doing this, because one of the reasons parents say is, well, it's not, if the kids get it, they're okay for the majority of it. So what would you say to parents, because now we're talking kids who are really young, about getting this vaccine?
Only about 3% of kids that age get COVID, but many of those who do have more serious manifestations and actually end up sometimes in the hospital. So it's a small cohort of kids, but they exist. But really, it becomes a question of the parents' comfort and talking to their pediatrician. Another issue is that, for the Pfizer vaccine, it's 3 shots, and for the Moderna, it's 2. So it's not easy for parents to keep going back and forth to a doctor's office. But these are decisions parents have to make.
Sure. It seems like this rollout happened pretty fast. Too soon? Any concerns? Because parents may say, well, how did this happen so fast? It's almost like the warp speed, right?
Right. Well, it actually hasn't happened fast. The study's been going for quite a while, the data collection similarly, and it's hard recruiting young kids for these types of trials, but the data is very robust, and these vaccines are safe and effective.
Okay. Let's talk about long-term effects, because that's the thing. Me as a parent, that's what I was on the fence about, saying, okay, well, we know short-term effects with some kids have the inflammation of the heart, but we don't know long-term effects. And so what would you say to parents? I know you obviously talk to your pediatrician, but that's a big concern.
Well, I guess 2 things. Firstly, myocarditis, which is the heart condition that you mentioned, was a special concern to the FDA, and they did specific data searches for that, and that did not happen. So that we can put that aside.
Okay.
Relative to long-term effects, though, the benefits of the vaccine certainly outweigh getting COVID-19, because we know that long COVID is real, and we really haven't studied it that much. So clearly, making sure these kids don't get infected in the first place is a priority.
And so the myocarditis, that's not an issue now. But again, the long-term effects, we don't necessarily know. Also, though, we now have Dr. Fauci, who was diagnosed with COVID-19. And so some may say, okay, well, this is supposed to prevent getting COVID. So why should I vaccinate my children if they could potentially get it?
That's a really good question. I think one of the major misconceptions about vaccinations is that it eliminates your opportunity of getting infected, and that's not true. What it does do is it minimizes the impact of the virus. It minimizes hospitalizations and deaths, as we've seen through Omicron. Lots of infections, very few deaths and hospitalizations. So when you look at your kids, you say, well, do you want my kid to get very sick or just a little under the weather? But again, it's a calculation that parents have to make themselves, and it's not easy.
Yeah, absolutely. No, it's definitely a difficult decision. And going back to Dr. Fauci, that was all over the internet yesterday. We obviously wish him the best and hope that he recovers very quickly. But do you think he could, experience some backlash? Because I think we were talking in the last segment, there's a little bit of a distrust when it comes to politicians and sometimes doctors and scientists.
Distrusts among politicians? That's shocking.
Yeah.
There's been a lot of there's been a lack of clarity, and to a certain degree a lack of honesty coming from Washington under the previous administration and this administration. But science evolves. Just because a scientist like Dr. Fauci said one thing 5 weeks ago, the science changes, and you have to accept that. They have to be honest and move forward.
Yeah, just moving quickly, we have the baby formula shortage that's obviously been affecting parents across the country. Now we had Abbott lab plant in Michigan. They had to close due to the extreme weather. This is certainly not something parents want to hear.
Well, there's a lot going on for parents with young kids who are on the razor's edge anyway.
Yeah.
It's just something else they've got to deal with. But the good news on the baby formula front is the plant will get up and running. It will start getting back to normal, and the shortages should be done certainly by the end of June.
Okay, well, that's good news. Hopefully everybody can get their baby formula, and vaccines will now be available for kids of a certain age. Peter Pitts, thank you so much. We appreciate you having us.
Thank you.